surgeries going on. Master janitors popping in. Surgery over here. That was the complicated fracture of the femur. Hopefully everything is now sorted out. There's some hidden symptoms over here. Okay, muscle and skin damage. Okay, seems to be under control there. Someone in TC down here. Let's have a look. Okay, chlorine gas poisoning. Nothing flashing over here. Should get them onto oxygen therapy and resolve that as quickly as we can. Finding some of the other symptoms, but nothing too serious. Yeah, currently hospitalized in IM as well. Good stuff. 8 a.m. is we're on the cusp of getting to 8 a.m. Oh, no critical workload during the night. That's really good. I'm very happy about that. Wow, look at that, those numbers. I want to quickly have a look at 8 a.m. to see when we get a lot of patients to leave. There are a few, not a lot though. Okay, and there we go. Okay, so here we've got 3,000 over there, a few thousand over there. Ooh, these are not coming out of there. And nothing from cardio. Oh, there's a little bit there and a little bit upstairs as well. Probably not the end of the stuff. We might get a little bit more money coming in. Yeah, a little bit more money coming in. Great stuff. Able to deal with the stuff. Up and down. Okay, let's add another crash to it. The crashes I find is slightly easier to deal with. A serious leak has occurred at a chemical plant. Authorities are advising local residents to stay inside with their doors and windows closed. The emergency services are now transporting a large number of people to nearby hospitals. 5 is not that many, so that's okay. Get stuff sorted out here. Oh, I hope we can actually figure it out. Chlorine gas poisoning. There's some flashing symptoms over here, so I hope you can find those. Over here we should be okay. Oh, I'm back with John over here. So John, you're figuring out some stuff for the eyes here. That was just from interview. Let's do a physical examination and maybe a basic visual test. Since you've got some red eye, not that I think that's going to be a big thing here. Neurological testing is probably the one that we should be looking at. None of them delivered anything. Let's do some neurological testing. Does the game have epi-pandemic events? It's got... it does, epidemic. There's an epidemic. It does have an epidemic. See, neurological testing doesn't give us anything either. Really? So what do? We send them to somewhere else? Now that's not great. Well, let's do the microbial sampling and just get it done. It's the only other thing we can do. Patient is collapsing. Patient, what's your problem here? You need to be rehydrated. Let's do that. Spasmolytics, we'll do some of that as well for the cramps. While we quickly try and, oops, that's not the one I wanted, the abdominal palpitation, and see if we can find something over here. Honestly, need to figure out some stuff here. Oh, actually, that was an easy one, wasn't it? Bloating. Good stuff. Didn't end up being the end of the world there. Okay, Jane, what are we doing? Why do we not know what's wrong with you? Ooh, still flashing stuff. Okay. This is I'm troubled by what's going on over here. Okay, let's have a look. What shall we do? There's just so much stuff here. Neurological stuff. Probably the internal medicine stuff as well. Blood tests. Physical. Okay, what can be the tough, the high stuff here? ECG. Anyway, that's irregular heartbeat. Let's try and... Has an ECG been done? Heart monitoring was done, but not ECG as per se. So let's make sure we do ECG as well and see if that helps. Differential diagnosis is also an option, definitely. I'm just worried to do differential diagnosis with so many stuff still there. But anyway, why can't we do differential? The doctor we're using probably can't do it. ECG didn't deliver anything. That's not good. Honestly, not good, but we still have time here. How much time do we have? 5 more minutes on this. Jane, we need to get you sorted. Do want to get you sorted. We've got a little bit more money now. Patient is collapsing. Oh no. Pneumothorax. What's wrong here? Chest x-ray. Do we do a chest x-ray? Let's do it. It's actually scheduled. Why are we having so many other things that we're doing here? Let's just get the chest x-ray done first, and we'll move on from there. Oh, excellent. Another successful event. That's quite helpful. Over here. Excellent. 12 in a row now. 2 more to go. 2 more to go. I'm kind of tempted to just get into it straight away. Monitored patient is collapsing. We need some abdominal surgery to go on, and you need some blood transfusion happening over here. We should be able to deal with that. Okay, another monitored patient is collapsing. Oh, coma, hidden stuff, penetrating trauma of the head. And I believe this is the one that we want. So we definitely need to get a CT done as quickly as we can. Let's do a CT. We need to do a craniotomy as well. We need to put you on some life support, meaning that we need to get you into ICU hospitalization. So to put you on life support, we'll put you on code blue as well. Life support. Yeah, let's get that CT done. Now you're doing other stuff too, huh? Hopefully you'll survive. Monitored patients collapsing, employees leveled up, is now at attending. Good stuff, good stuff. I just still don't get why we're not able to sort out John's stuff over here. Wow, 50k? Look at that. Pretty decent budget. What's going on with our statistics for rooms now? So if we say, that's okay. There's critical, still 1 critical in X-ray department. Yeah, maybe intensive care unit needs a few more nurses. Medium and high. So yeah, maybe neurology does need another doctor. I'm going to add another doctor to neurology. Upstairs. Probably, okay, let's quickly sort out a little bit of space here. We'll get rid of the plant. I'm not sure the bin will work either. Yeah, anyway, that's okay. What I'll do is we'll grab an extra table. Don't know if it's going to work here. In there? You know what we'll do? We'll move this thing up against there, and we'll put the table over here in the corner. Something like that. Get us 2 more doctors over here. Should be a good thing. 2 more doctors. Okay, let's get an evening doctor over here. Someone that can do what exactly? So we've got an anesthesiologist, we've got a surgeon, we've got an assist with surgery. So just a standard kind of doctor, right? Maybe diagnostics is a good one. That doesn't seem too bad. We'll grab you. And you, on the other hand, you will not be assisting with surgery. You'll just go and do diagnostics. We'll get another daytime doctor as well. Just someone with diagnostic skills, maybe. Kate. They're all pretty senior here. Maybe we'll get someone that's not quite as senior. Let's pay a little bit of money for this. Yeah, that's not bad. Let's grab. Oh, that's too much, huh? Dana, anesthesiologist though. Let's just grab this guy, Jordan. Welcome to the team, Jordan. You're just going to go with diagnostics for now, not with assisting with surgery. But hopefully that's going to be sufficient. Awesome. You don't have water up here, do you? Let's get some water in here too. So I do want us to get these guys not to be... where's the corridor has the water machine. So we'll get the water machine. Something like that. Excellent. Probably need a water machine out here as well. Something like that should work. Nice. Non-surgeons should dedicate for diagnostic only. Yeah. Yeah, that's the plan. Employee leveled up is now a specialist nurse. Another specialist. Okay, it is. I think it's time for us to do another crash, or let's do an epidemic. See how that goes. Food contamination at a local restaurant has caused a serious outbreak of illness. Even though health inspectors have closed the restaurant down, local hospitals must prepare for an increased influx of patients. Let's quickly see what we can get. Hopefully we can get these numbers up a little bit more as well. Okay, that should be okay. Why am I? Oh, I know why. It's back at John. Back with John. John, let's quickly do maybe a physical examination. See what you get from that. Not much really. So now we know there's some fatigue and stuff here. So let's do a kind of chest auscultation, maybe abdominal palpitation as well, and then maybe some speech listening. I don't know. Can't find anything, huh? That's not good. It's really not good. Let's measure temperature, even though you should be picking that stuff up. The other stuff is all basically lab stuff. Whoa, we're not doing a good job here. 2 with critical workloads. Okay, elevated CRP. Okay, now we're at least getting a little bit closer to the action. So what is the next stuff that we need to do here? Interview, temperature, we've done physical, abdominal palpitation, we've done stool analysis. It seems like blood test, stool analysis, the kind of tests that we do in the lab is the ones that we need to look into. So let's do a microbial sampling and a stool collection. And you want us to do a CT? Okay, let's do a CT. Let's then forget about the stool collection. Thanks, Doc. Always good to get the advice. Okay, 40% of patients have already been cured, and we're going through them fairly quickly. Jennifer Taylor over here is the one that we're actually looking at the moment. Charles Wright has taken her over. So we're probably not going to get the bonus there then. Microbial cultivation. Did they do the CT? They did do the CT and they did find what was going on there. Okay, so let's get her onto corticosteroids and all the other bits and pieces that we could need here. Okay, do that. That should do the trick there. We're going through this pretty quickly. Everybody else has kind of been... So you should... Probably waiting for surgery. Yes, okay. That's okay. Don't mind that. And then over here, what do you have? Salmonellosis. And are we treating you with that? Antibiotics? No, why not? So stop doing other stuff and let's just get some antibiotics in place and we'll do all the others as well. Okay, hopefully that should get you all sorted out. Treated. Nice. Okay, now we're just waiting on this one surgery over here. Insurance payments back to normal. Let's quickly go to general and see what the surgery list looks like. Why? Oh, you've been done? Laparoscopic surgery. Why not? Come on, do the laparoscopic surgery then. So why? Oh, gallbladder rupture. So why did we do the abdominal surgery first? Oh, because of the rupture. Okay, fine. Fine. Okay, so let's just get all of the other stuff sorted out. Nothing here is flashing, so hopefully we should get you on there as a high priority to get the other surgery done. Good stuff. A monitored patient is collapsing in ICU. You're on code blue. ECG, so antiarrhythmics. Do we need IV infusion? Yes, IV infusion as well. Antiarrhythmics needs to be assigned. Let's just get a bandage on it as well for the head injury. Another monitored patient is collapsing, and here we still have some traumatic brain injuries. The CT and stuff needs to run. So what do we need to do? Get you onto life support. So how are we going to deal with this? We need to put you in ICU. Okay. From there, we'll get you onto life support, and we need to do the other testing bits and pieces here. You need to be like a code blue kind of patient. 90% done. There we go. 13 in a row. Nice. So the epidemic was quite easy to handle in the end. We'll quickly do the final one before we move over to Rescue HQ. Everybody excited for a bit of Rescue HQ? Okay. Money situation is looking decent. Always tempted to see whether we should add some more hospital beds while we have this going. They're not full. Maybe we should grab a couple of extra hospital beds over here. So neurology. Actually, I want to do that. We'll grab some of these modern hospital beds right there. Just grab 2 more, I think, is going to be the right thing for us to do. Get a couple of bed sockets there. And some end tables or cabinets or whatever, bedside cabinets. There's one there, there's one there. Why do you have a sword badge? Because you're a moderator. Oh, and by the way, I've added into Nightbot a little bit of functionality. So if you in the chat now do exclamation point links, I believe you will find the links to the affiliate, all the various affiliate links. And if you do exclamation point reg, you'll find what my PC specifications are. We just added a little bit of functionality there, so it's a little easier to kind of answer some of those questions. Oh, they shouldn't be red, actually. They should be red. Can I just make that red, please? Thank you. Red, please, over here. And then we just need the life monitors, I believe. Life monitors. Can we just get them? There we go. Life monitors over there and over here. Okay, so we've got a little bit of extra stuff here then. A little bit more room in there. Nice. Almost through night shift. Onto our second day without a loss. Hope we can keep that going. Our patient numbers are pretty low still. If we have a look at this, are these kind of coming up a little bit? 10, 20, 30 over there, 15, 10 over here. We need some of these things to come up quite substantially, but they are paying us a lot more money, I would imagine. Oh, I need to hydrate. Thanks, Doc. Ah, got it. Now, okay, so we're almost, it's end of the shift now. Hopefully we're dealing with this. Yeah, we are, though I'm a little worried about the flashes over there. Okay, then if we have a look, how many people do we have in beds over here? A fair bit in the wards. Would be awesome if we can make a lot of money. Ooh, looks good. Looks really good. Lots of money. Nice. Ooh, good stuff. Good stuff. Our money is coming in. Getting much better with the money. Let's see. Can we... Oh, let's... Oh, wrong way. Let's repay the last of our stuff here. Nice. We're out of debt. Procedure finished over here. So John is looking at some stuff for us. Yeah, probably that's not bad to do this one. Athlete's foot. Let's just treat you. Anti-fungal. We'll just get the other stuff going as well, and hopefully that means we're getting that one of these done. Correctly diagnose controlled patients in intern mode. I don't think we're running intern mode. I think that's the issue. I think that is the issue. So we're not actually picking this up. I don't know what is intern mode. Okay. Oh, this is normal mode. Okay, hang on. What is intern mode? Let's have a quick look. Normal mode. All patients. So how do I... Okay, hang on. How do I go to... How do I go to intern mode? No diagnosis. I'm not in intern mode. Okay, no hints. Ah, there we go. No hints in diagnostics. Oh, okay. Well, let's run intern mode then. There we go. Okay, I quickly want to run one more crash. Okay, let's see what's going on over here. You've got insomnia, so we'll treat you with that. So it gives you some sleeping drugs. Wow, all of these things. Tranquilizers, antidepressants, sleeping drugs, get some rest. There you go. Should be fine. Send you home. Thank you. Oh, there we go. Now we're actually starting to get some people here. Let's run one more crash. Quickly try and get that done, and before we just end things over here. 5 more patients coming in. Nice. I think we should be able to get that one sorted out. Not sure we'll get to that. Okay, procedure is finished over here. Okay, calm down with the sirens, please. Okay, I would like us to do a physical examination and see where we go from there. Okay, we picked up a lot of stuff here. Let's pause it while we see. You still have something going on here. So what is likely your problem here? Before we diagnose, let's do some blood pressure management, or measurements at least. Can we quickly have a look and just see? I just want to see that we sort you out. Actually, if we give you the same hypertensive medication or beta blockers or cardiovascular surgery, okay, yeah. So I would like us to figure things out a little bit over here. Oh, blood pressure management didn't actually deliver anything for us. Okay, let's try an ECG, please. Let's not worry about that too much now. Can we cure a few people? Okay, now someone else. Okay, deep wound of the foot. Okay, we'll do that. We'll close the wound and get it all done with. We need to stop the hemorrhage. Wound closure, anti-hemorrhagics, some emergency care wouldn't be bad. All of this, let's do that. Nice, let's finish all of that off. Just treat him. Okay. Yeah, okay, sure, it's probably I'm just, yeah, okay, fine. Fine, you're the doctor. I'll not worry about that then. Okay, so that's, all of that's done. Okay, so let's, okay, so now we've got you open up over here. So we're trying to get the ECG done. Fine, let's schedule that. So for this, we need to assign you to the cardiology unit for treatment, and we'll get you into regular hospitalization, get you some cardiovascular surgery, I believe. Yes, absolutely. We'll also provide you with some of the other medications and stuff that you need. Dana, wound closure, you're done. Devolved skin, degloved skin. What does that mean? An extensive area of the skin is torn off from the underlying tissue. Wow. So can we do this? Can't be prescribed in this department. Wow, surgical reattachment of a body part? We need to do that. Why are we not fixing that? Orthopedics. I need to send you to orthopedics. Yeah, absolutely. Orthopedics, please. So that we can absolutely do replantation and regular hospitalization immediately. Come on. That is just crazy. Crazy that we didn't, that we were able to send you home. Wow. Okay. 5 more minutes left on this. What's going on here? Ooh, this one's not been diagnosed. Oh, yeah, fine. The last one to be diagnosed here. There's still a hidden symptom, gonioscopy. Okay, perfect. Corneal abrasion. Is that a surgery thing? Eye drops only. Oh, excellent. Well, let's give you some eye drops then, and then we should be treated. HTU hospitalization. Excellent. And another one down. And we've done that, and so we've got a prestige boost. And now it's going to say another 10 successful events in a row. That's just why. That is just, it's getting out of hand, guys. It's getting out of hand. What do we get for that at least? 300,000. Did we get a lot of money for this? I can't remember if that, no, it was only prestige. Wow, look at this. The money is going to roll in here now. A master janitor. Procedures have finished. What's going on over here with John? Okay, so we kind of know what's going on. There's no flashing stuff in there, so we'll just get into diet modification straight away, huh? Okay, well then let's do some of this stuff. Do some rest, get some sleeping drugs sorted out. You should be okay. Get you treated, and we'll send you home. Nice, good stuff. All done. Are we getting? Yeah, we're actually moving through this pretty quickly now. Like it, I like it. Doing more events. There's a lot of events that needs to be done all the time. Where are we at? Yeah, we're getting our full complement of patients here, but it's not close to the 100 that we potentially need. So if I have a quick look at John's stats, right? He's getting a 96 doctor rating over here. Is he? Oh, he's going to level up from, intern mode. So it doesn't need to be a doctor. You can do any doctor. Okay, so we can do a number of doctors actually at the same time potentially. Okay, but he's going to level up from intern to, I think, junior doctor very soon. His diagnosis skills is pretty high. I like it. Monitors patient is collapsing. What's wrong with you? Respiratory failure. Artificial ventilation then, please. I'm assuming that's not something you can get in HDU, right? You need ICU for that. Oh no, any office. Okay. Well, let's hope we can save you. Another monitors patient collapsing, breathing problems, heart failure, defib. It's been done. Is this surgery? Oh, nitrates. We are actually doing everything. So let's just sort out that last symptom there. I think your hospital has reached max potential. It's time to make a new series with more focus on aesthetics. Well, what I was thinking is now that we've got money, because it's for the first time that we're now actually making money, I actually now want to go in and tweak the aesthetics as we run through. But yeah, this whole 10 additional stuff here is getting a little bit out of hand. But yeah, I want to go through and do the aesthetics now. So I think what I'll do is we'll play one more session with this. Oh no! That means we're not going to get this one. Ah, crazy. Crazy. Well, we'll do the autopsy. So I think the next time we play, in the next stream, probably maybe the last one. And what I'm going to try and do is I'm going to just try and clean up the hospital, get it nice and aesthetically done well. I think it's not too bad. We just need to do a few tweaks to it. Okay, pathology, doing the autopsy. Let's quickly go upstairs and see how that's going. How much money we're going to make from the autopsy though. 1,700. Elevated LDL. Okay. We can send them away. Monitors patient is collapsing over here. Ooh, this is scary. Subdural hematoma. CT. I think so. CT is what we need to do. Can we get to CT as quickly as possible? Can we just cancel all the other stuff and go straight for CT? We also need to do the craniotomy. Yeah, that's definitely something we need to do. Start doing some of this stuff too. CT, please. And in ICU, there we go. Okay, well, I think we're going to end the Project Hospital part of the stream right here. I think now we are making some decent money. So, as I mentioned, we will go and clean up the hospital, make it look nice, get a courtyard outside, all these kind of things. Renovation of a nearby clinic causes 20% more patients for internal medicine only, so that's not necessarily great. Employee specialization is available for a janitor. No, not quite. Okay, that's fine, guys. I'm gonna leave you there. I'm gonna quickly switch off the stream, and we're gonna start a new stream, and we're gonna head into Rescue HQ. I'm quite excited to continue that one. See you in just a bit.